In our community where we live here in South Texas, we have such a large proportion of people with diabetes, and it's a growing problem. It's an epidemic.
My name is John Kittleman. I'm the General Manager of KRGV TV, the ABC affiliate in the Rio Grande Valley of Texas.
Hi, my name is Dr. Munzir Yadzri. I'm currently the President of Rio Grande Valley Diabetic Association.
Hi, I'm Dr. Steve Lieberman, Interim Dean of the KRGV School of Medicine.
Channel 5, KRGV, created something called Heart of the Valley, where 4 times a year we target issues of concern in the valley. And the very first one we did in 2016 was on diabetes. And that was a 2-week effort where we told stories, we profiled individuals and the challenges they face, perhaps someone who lost a limb, someone who lost their eyesight, someone that's paying a high cost. We examined what the resources are through the county, through the state, through the national resources, and so on. So a 360-degree look at this issue that has been described. We partnered with outside folks like HEB and others, Dr. Yaji and his offices, to offer free glucose screening. Almost 7,000 people were tested over 2 weeks in 2016. So we knew we were onto something really big, that there was a need in this community for this education and this outreach. That led us to 2017, where we repeated Heart of the Valley Diabetes. We expanded to focus on obesity because we know that there are related metabolic issues that come from being overweight that contribute to diabetes and other problems. So again, we partnered, but this year we decided, let's take it a step further. Let's create something called Together for Our Health, where we bring together the best of the community has to offer. So KRGV, not only the School of Medicine, but all of the colleges that can contribute to a healthy lifestyle and education towards this epidemic. And what professionals can do. I was surprised to learn that perhaps not all professionals treat diabetes the same, that it is a multidisciplinary approach, that your sleep habits, your eating habits, your exercise habits, your psychology habits, all of these things are important for people to realize that you can't, if you're stressed out through your life or work or so on, your poverty, your access to food, you're not able to address this issue fully, and that impacts our community. So this opportunity to bring together the resources of the University of Texas Rio Grande Valley, the resources of the medical community, the power of the media to tell these stories, all came together in Together for Our Health. And that was a day for education, for collaboration, for doctors, patients, and the community to really learn about this issue in a way that was really extraordinary and a first-time effort. And so Dr. Lieberman, we were so proud that you stepped up for the College of Medicine, but also the entire college, that said, hey, this is an issue in our community. We have resources that we can direct towards this issue, and we can make a change, and we can make a real difference. So thank you.
Well, listen, it's our pleasure to be part of this. It's important to KRGV, the whole university, not just the School of Medicine, to reach out to the community and to make a difference in the community. Just as you point out the importance of an interprofessional approach, not just doctors, but nurses and other health professionals, the School of Medicine and our KRGV College of Health Affairs, we're very involved in this effort. It really is an interprofessional effort, and we're delighted to be able to help out. Many people were screened and at the event, and when they needed follow-up, the School of Medicine and the College of Health Affairs, through our outreach efforts to various parts of the valley, including the colonias, were able to provide follow-up care and follow-up appointments. So it's more than just a screening and then letting people know the information and not giving them any sense of what they need to do with that information. It's actually providing the opportunity for them to get the follow-up care that they need. It's a challenge in an area where there's so much poverty and such a high proportion of uninsured patients, and very underserved in terms of medical professionals.
Because we did CMEs in this, and the purpose was to bring all the health providers to higher level, to the same level, to be able to understand this disease in multidisciplinary approach instead of just a doctor himself. And this will bring all the providers to the level that they're really reaching the best practice medicine or the best evidence medicine in the nation, which really have the, I would say, fee for value instead of fee for services, and also cutting the cost, which is, this is the best practice in the whole, United States and world, and we're given an example. Therefore, I think this was a big message, is professional, to the student, to the patient, to the community came together, and I think this is the way, the starting points, which we think, we should, from now on, start looking this way and build on it to reach farther and to achieve really our goal to improve the health of every, human being in this valley.
We would like to expand this across the valley. We would like to expand this with more partners. We have great partners this year. Not only HEB stepped up in all their locations offering free screenings across the week, South Texas Health System locations offered as well, Dr. Yaji and his locations as well. The college came through, the multiple colleges within the university. Each person we've asked to step up has stepped up, and that makes the effort better, because we can't, individually, any of us can't do this by ourselves. But we all have unique resources that we can add, and working together, again, together for our health, we can make a difference. I think lots of communities face challenges. The challenge we're facing is this epidemic of diabetes and obesity. But I think this is a model where you have partnerships and you have community efforts, because we have great people here with a great passion. And but with a little bit of education, a little bit of hard work, we can identify and we can manage and we can move forward. So from the viewpoint of the television station at KRGV, thank you so much for working with us. We look forward to the future and the possibilities that are available.
Thank you. Thank you.
Thank you.
Thank you, Dr. Lieberman.